Simplified summary, clindamycin. Mechanism of action. Blocks protein synthesis by binding to the 50s ribosomal subunit. Specifically stops peptide translocation. Bacteriostatic, slows down bacterial growth. Clinical uses. Treats anaerobic infections especially above the diaphragm, example mouth, throat, lungs. Aspiration pneumonia. Lung abscess. Oral infections. Bacteroides, Clostridium perfringens. Also used for group A streptococcal infections. Mnemonic comparison. Clindamycin equals anaerobes above the diaphragm. Metronidazole equals anaerobes below the diaphragm. Side effects. Pseudomembranous colitis, due to overgrowth of C. difficile. Fever. Diarrhea. USMLE Question 1, Clinical use. A 65-year-old man presents with cough, fever, and foul-smelling sputum after a recent episode of vomiting. Chest X-ray shows a right lower lobe infiltrate and cavitation. What is the most appropriate antibiotic? A. Azithromycin. B. Ceftriaxone. C. Clindamycin. D. Vancomycin. E. Gentamicin. Correct answer, C. Clindamycin. Explanation. A. Azithromycin, good for atypical pneumonia but not for anaerobic aspiration pneumonia. B. Ceftriaxone, good for community pneumonia but not specific for anaerobes. C. Clindamycin, correct. Used for aspiration pneumonia and lung abscesses caused by anaerobes. D. Vancomycin, covers MRSA and gram-positive organisms, not anaerobes. E. Gentamicin, covers gram-negative rods but not anaerobes. USMLE Question 2, Side effects. A 30-year-old woman develops severe diarrhea 2 weeks after finishing a course of clindamycin for a dental abscess. Stool studies are positive for Clostridioides difficile. What is the most likely explanation for this condition? A. Type I hypersensitivity. B. Drug-induced lupus. C. Overgrowth of resistant anaerobes. D. Direct toxicity to the colon. E. Immune-mediated colitis. Correct answer, C. Overgrowth of resistant anaerobes. Explanation. A. Type I hypersensitivity, causes rash or anaphylaxis, not colitis. B. Drug-induced lupus, seen with hydralazine, isoniazid, not clindamycin. C. Correct. Clindamycin disrupts normal gut flora, allowing C. difficile to overgrow and cause pseudomembranous colitis. D. Direct toxicity, not the mechanism of action here. E. Immune-mediated colitis, this is infectious, not autoimmune.